So, hello, Synergy. Today is December 15th. We are midway through the month and almost at the end of the year. And this is a special session with a special speaker from our senior batch. And I don't think I can do justice to the introduction. So, I'm going to share this introduction Shirish has prepared. And hopefully, my sharing will work with audio. So, let's see. I will make sure I share the sound and play his recording, and you guys will let me know if okay. I shared the wrong slide, but let me pull it one more time. Okay.
Namaskar, Synergyites.
Know if you can hear.
Greetings from the far east side of the globe, and a warm welcome to the December session of Synergy. First of all, congratulations to the entire Synergy team for 3 successful years of meaningful discussion and enlightening information. Kudos to all the Synergy organizers for that. So the December session of Synergy is dedicated to a specialty which takes care of not only the most visible personality, most visible aspects of one's personality, the nose, but also some very important sense organs in our lives. And the guest
I cannot
today
hear.
is none other than an authoritative figure.
Okay, I was afraid of that. So what we'll do is we'll go on to the session, and I will share that with the group later. The introduction that
I can hear,
Shirish-
however. I could hear it fine.
Oh, you could hear it? How about you, sir?
I could hear it.
Bharat needs a hearing test. So that has been decided. So
It was fine, except the 1.5 times the speed is a little fast.
Okay, what I'll do is I'll come to the point where he is talking about Kakani, sir, and I'll just play it quickly, and then we'll go on to the sir session. Sorry, Bharat, hearing test, okay?
That was a catch, that means. Okay. And who knows that actually nobody was hearing. You are just making me a fool. Hello, Rajesh sir. Nice to see you again. We met briefly, if you remember, at MGM.
Okay, I have lost that share now. So, sir, we will start with your session and we will redo that at the end.
Okay, so thank you so much. I am in a real August company. Bharat sir, yes, I met him at the 75th Jubilee of MGM Medical College. And to say it will be an understatement that I was impressed with his knowledge, his sincerity, and his exuberance, okay, and willingness to help. And since then, I have attended some of these synergy sessions. So I am honored to know each one of you. Of course, you're all friends. Without further ado, we're going to keep it interactive. I want to sort of eventually get to whatever you guys are interested. But I thought dizziness and vertigo is a problem that is common in all kinds of practices. And, when you try to learn about it, the theory can be a little bit too detailed and you lose interest. So, and therefore, I wanted to distill down whatever common sense approach. The conversation today is aimed at primarily primary care providers, but also, because it's going to be recorded on YouTube, we would distill down the language so that if a lay person listens, they may also be able to take home some points. My apologies in advance. I had an unexpected emergency and I anyway prepare my slides at the last moment. So the slides will not do justice, but in the question answer session, hopefully we will be able to get a little bit more, okay? So let me see how I shared. Do I have to? Okay, all right, let me see.
I was going to say there's no gold medal for Zoom so far. So
Okay.
none of us is going to contest
Then
for it.
let me see selective. I'm going to try to share my old slides first. Okay. All right. Okay. Can you see my slides? No. Okay.
Now we can.
And I'm doing it from this thing. Okay. This is not going to work. Okay. All right. Can you see my slides a little bit?
Yes, we
Okay.
can see full screen.
Okay.
Yes.
So again, in the interest of time, we'll get down to the basics. To me, balance is an amazing thing. Okay. Balance is a miracle. It's a miracle that all of us are continuously in balance, and balance depends upon everything working together: the inner ear, the eyes, and there are sense organs in our joints and muscles, which are called proprioceptors. And all that information travels to the brain, including through our spinal cord. So everything has to work well, and the brain and the blood circulation for each of those. So when people have balance problems, it could be any one of those. Okay, this is a complex picture. So before I get started, I want to say two more things. One, I've learned from my gurus, so this is a good time to say thanks to our gurus. And I would say Guru Brahma, Guru Vishnu, Guru Deva Maheshwara. And I think, Bharat has been in a place where he's sort of teaching, and also we're all teachers. Shirish has been in the place, and Anurag. So my thanks to my teachers. And then the second thing I want to say is I salute each one of you, because you work in different settings, and practicing in Indore is not easy. If I went to practice in Indore, I would be a failure, okay? Because there's a totally different socioeconomic environment. And therefore, I salute each one of you who manage and take care of things with limited resources, with people's comparison to alternative medicine and stuff like that. So my salute to each one of those people who practice in India. So I say this, that, I divide people. Oh, we get one other concept out. In India, sometimes you would get a symptom called ghabrahat. So to me, ghabrahat is, I think, roughly translates into anxiety, and it's not dizziness and vertigo. So coming to the dizziness, I divide it into big two chapters. I'll say anybody with any balance problems will put a label on them, and we'll say, you, Mr. Smith, you are dizzy. And only some of them have spinning sensation. And then we say, you, Mr. Smith, you, Mr. Patient, not only dizzy, but you also have vertigo. And dizziness and vertigo, they are not a disease. They are just a symptom. And now it's the job of the doctor to try to find out why the patient has dizziness or vertigo. In general, if it is not spinning, it's not ear. So that's the first take home point. Okay. So if the dizziness imbalance is not involved spinning, it's probably not coming from the ear. Okay. Not coming from.
Sorry, Dr. Kakani. So I sorry to interrupt you, but spinning is spinning of self or spinning of environment, or either or both?
Doesn't matter. It really doesn't matter. Okay. So if the patient feels spinning, it probably has something to do with the inner ear or the connections of the inner ear to the brain. Okay. If the patient says, no, I just feel imbalanced, then it's probably not only ear, it's probably something else as well. Okay. So the cause of a spinning could be in the ear, or it could be in the connections to the brain. Here's the ear. And I joke and say our ear has three parts: the outer, the middle, the inner. And believe it or not, these are three different organs. The outer ear came from the skin when the baby was growing up in mommy's tummy. The middle ear came from the nose, and the inner ear came from the brain. And and these are just three different organs that align. So the diseases of the outer ear and middle ear usually do not cause rotatory vertigo. So that's the other take-home point, that if somebody has spinning vertigo, the inner ear or its connections to the brain are affected. Middle ear diseases can affect inner ear. Okay. So this is the next point. The clearer the patient can give you a description of the vertigo, the more likely it is related to the ear. Okay. The next take home point is that in vertigo and dizziness business, history and physical examination are 90% of the game, if not 99%. Okay. And you really need to take a good detailed history from the patient. And I would put everything aside and I'll ask them to tell me when it started, whether it is continuous or it comes in attacks, how long each episode lasts, and what brings it on, what gets it better. All right. So when they say it's not really spinning and it's lightheaded, then you got to think about, the other possibility. And in my practice, orthostatic hypotension is probably the highest possible thing. And we'll come back to that in a minute, but there could be other issues. So history is 90% of the game. Get a good detailed history. Okay. Is it constant or is it attacks? Then the other thing I would ask is, what is the associated symptom? Is there associated feeling of blocked ear? Is there associated buzzing sounds in the ear, tinnitus? Is there associated nausea? What brings it on and what relieves it? You're going to do a good ear examination, by the way. That's the third funny take-home point. The new operating system of the iPhones, the iOS 18, plus the AirPod Pro, the new AirPod Pro combination, now allow you to do your own hearing test. Again, I have no, financial interest in promoting any of those products, obviously. But I did the test myself, and it actually gives you a pretty good hearing test. So if you don't have access to an audiologist and you have your own good iPhone with the iOS 18 and AirPod Pro, you can do a good hearing test. Of course, you're going to look in the ear that there is no wax, there is no middle ear disease. So examine the ear, do the hearing test, and do the Romberg test. And then you're going to do what is called positional texting or Dix-Hallpike maneuver. Again, there's lots of YouTube on Dix-Hallpike maneuver. See it from an MD. And then my next joke is, this vertigo business, patients will either go to a neurologist or they'll go to an ENT. And only few neurologists are interested in vertigo, not every neurologist. And very few ENTs are interested in vertigo, not every ENT. So you may need to find the doctor who's interested in vertigo, okay? Rather than just going by the specialty. You're going to observe the nystagmus, and Anurag can probably tell you, Anurag and Shirish can probably tell you more than I can with this. But the summary is the direction of the nystagmus is important. And when we have, and it's uncommon, when we have one ear has inflamed or dead, then patient gets horizontal nystagmus, which is worse on the side of the ear, which is more active. So, okay, this is another good take-home slide for spinning vertigo, okay? And if you get a good history and a good examination, and if the patient is spinning, the last column will classify your patient into 4, 5 broad category of inner ear diseases. So if a patient comes and says, my vertigo was rotatory spinning and it started suddenly. And I also have a hearing loss and buzzing sounds. And it is continuous, going on for more than 6 hours. Then it's some kind of an inflammation in the inner ear. If they say I get attacks and each attack lasts several minutes to maybe up to 2 hours, maybe up to 6 hours, and then I get better, then it's more likely Meniere's. And in my practice, this third type is very common, which is patient says, I feel really bad vertigo, but it lasts less than 2 minutes. And it only comes when I turn in bed to the right or to the left. Then it's more likely benign paroxysmal positional vertigo. And then there are other less common causes. Okay. Um, so let's get to the positional vertigo, which is the bane of my existence, which is the commonest thing I see. Um, in oversimplified English, I say there are three possible common causes. One is BPPV, which we just talked about, which has to do with, so our inner ear, the blue part, has three parts. I mean, it has two parts. The circle part is the cochlea, which is related to the hearing part, and this other part is the vestibule, which has the balance organs, and it has five sets of sense organs, and each sense organ is aligned so that we have five on this side and five on this side. And as long as all five send a congruent message to the brain, our brain thinks we are in balance. So those 10, call them CIA agents, plus our two eyes, plus our agents in our muscles and joints, if they all send a same message to the brain, oh, we are moving, then the brain thinks, okay, we are moving. If they all send the same message, we're not moving, then we're not moving. But if some of them say we are moving and some of them say we are not moving, that's the dizziness. That's all the dizziness is all about. So you need to figure out which agent is sending the wrong message, and you try to fix that. Okay. All right. So the other two causes of positional vertigo in my practice are orthostatic hypotension, and I take people off sedative medicines and they get better. Okay, that's all I have to do. Take a good detailed history, take them off the sedative medicine, and they get better. So orthostatic hypotension is a common cause, and then the third thing is, and I'm explain it in oversimplified English, is that we have two big blood vessels in the front and two smaller ones in the back. Those four blood vessels supply the blood to the brain. And if one of those back ones, the vertebral artery, is pinched and you turn a certain way, you may get dizzy. That I call vertebrobasilar insufficiency. So in general, I use medicines at two levels. One, if they have a severe attack, during that attack, they may need an antihistaminic medication like meclizine or dramamine. And then the other time I would use medicine is in people like Meniere's disease, where the attacks keep coming and we give them medicine to prevent the attacks. In general, other than those two situations, I avoid medicine. Now, if somebody has sudden sensory neural hearing loss or labyrinthitis, an attack that's lasting more than 6 hours, then I use prednisone in the acute phase as well. So those are three sets of medicines. I am going to, okay, let's do this. So when it's time, I'm going to have Chayaji share a little YouTube video. So when people come to me with positional vertigo, I teach them this habituation exercise and let them do the habituation exercise for a week. That A, makes the vertigo more tolerable, and B, when they come back for the definitive treatment, the post-treatment nausea vomiting is much less. All right, I am going to, okay, let's quickly talk about Meniere's disease. Meniere's disease, this Dr. Prosper Meniere, 19th century, described as a syndrome of attacks of vertigo associated with blocked sensation in the ear, hearing loss, and tinnitus. Not every patient has everything associated with nausea. It usually occurs more common in young ladies. Usually only one ear is affected. Um, the diagnosis is based on a good detailed history and examination. We do an MRI primarily to rule out other causes. The additional take-home message for ENT people from my side is think of Meniere's disease like a migraine of the inner ear. Okay, so how do you manage migraine? You have people sort of keep a diary what precipitates the attack. Okay, and then you may find out that eating certain thing, certain types of food, or taking certain high doses of salt may cause it more. But if you have Meniere's disease, you're going to need to see an ear, nose, and throat or any neurologist. So I'm not going to go into the detail of the treatment, but except to say good history examination can help you diagnose. And to think of it as a migraine, keep a vertigo diary and avoid. Okay. So for treatment of the positional vertigo, we sort of basically, in oversimplified English, there are otoconia, those are crystals in our inner ear. And as I said, there are 5 sets on this ear, 5 in this ear. And if one of them is broken or displaced, we turn the patient a certain way and put those crystals back in place. The commonest BPPV is posterior semicircular canal. And there are videos. I would refer you to a video from House Ear Institute on how to do the Epley maneuver, if you want to so do it. Okay. We talked about Meniere's. Vestibular neuronitis is the condition we sometimes see. We think there's an inflammation on the nerve of balance, and we use steroids. These are people who don't have a hearing loss. All right, I'm going to stop sharing. Okay, this is another take-home slides in terms of other dizziness diagnosis. Okay, maybe one more, okay? If somebody has a balance problem, take a good detailed history, examination, see what other things can be causing their decrease in their sensations, like peripheral neuritis of diabetes, people who have had a knee replacement, their sense organs in the knees don't work, and they will have balance issues. And the key home there message is try to get them off the sedative medicines. Work with the cardiologist. You don't have to have a really tight control of blood pressure. And number 3, they need to observe fall prevention precautions. So they must have good lighting. They should wear better fitting shoes. And they should arrange the home furniture in such a way that if they fall, they don't get injured. I will probably stop sharing at this point, and then if somehow, let me just say, if somehow Chayaji can show my 2 videos. They are on YouTube. If she cannot, I'll look for it also.
Sure. No, I have them pulled up. Hopefully, they will have the audio.
You have to have them in separate windows to share. Okay.
Yes, let's do one by one. So if you can just give me thumbs up if you can hear, but I'll make sure the share sound is on. And this is the first video. Let me make it bigger.
Okay. All right. So this is a different topic.
I am Dr. Rajesh Kakani.
Oh, sorry. Is this a...
It's okay. Now you're here. Let's do this one.
A board certified otolaryngologist. Take a look
Oh,
at this strange
gotta be
device that
ready.
I'm holding in my hand. It's smaller than a
the
quarter,
ads
but I believe
popped
it's
up,
going to
but
power
hopefully
Elon
it
Musk's
will.
next
Through the end.
AI revolution.
Hold on.
A revolution that he believes will be worth more than $9 trillion.
We should
That's
have
nearly 10 times more
no
money
ads
than the
in this, but
valuations of Tesla, SpaceX, PayPal, Neuralink, and X combined.
Laryngologist, that is an ear, nose, and throat doctor practicing in Long Island, New York. Thank you for asking me about the hearing aids. Number one, today's hearing aids are much better than the hearing aids that used to come 5 or 10 years ago. Each of them is a computer. They have rechargeable batteries, so you don't have to replace the batteries. They communicate with your smartphone using Bluetooth technology. You can control your hearing aids from your phone. You can listen to the music from your phone directly into the hearing aids. You can have a conversation using your phone without actually holding your phone next to your ears. Next, when you wear a hearing aid, nobody else will see them. So please don't worry about the looks of the hearing aid. Once you wear the hearing aids, you will hear better and therefore you will look smarter. Next, unfortunately, Medicare does not pay for hearing aids. If you have a secondary insurance, a different insurance, or a Medicare Advantage plan, please ask them if they would pay for hearing aids. If your insurance pays for hearing aids, please follow their guidance. If they only give you a coupon or a discount, please focus on how much you would actually be paying out of pocket. If you are a United States military veteran, you can get free hearing aids through the Veterans Affairs Hospital. Next, when you're buying a hearing aid, you think you're paying for the machine, but more important than the machine is the service, the programming, and the expertise that you need. So please, don't buy hearing aids online or from mail order. Buy the hearing aid from a place where you feel comfortable going back to. For most people in the USA, Costco has the best prices and reasonable service. If you want a higher level of service, go to an audiologist, preferably one located in the office of an ear, nose, and throat doctor. It's hard to beat Costco prices, so you will probably pay more in an audiologist's office, but you will get better service. Next, if you buy hearing aids anywhere in New York State, you have 45 days to try them. If you don't like them, you can return them and you will get most of your money back. Next, all audiologists are trained professionals. Since they don't want you to return the hearing aids that you purchased, it's in their interest to get you the best hearing aid for you. Please find a good audiologist that you trust and that is convenient to you, and then follow your advice. If you have any questions,
You can stop it.
please feel free to call my office or go to our website,
You can stop it, Chad.
516-222-1105.
Okay.
it must be nice to see yourself.
All right. I did
I'm
these
sorry, I
videos
think it went in
primarily.
the wrong order, right?
No, let me try to share the video now. Hold on one second. We'll probably avoid okay, no, okay, subscriptions.
I have the other one pulled up if you want,
Yeah,
like, play
yeah,
it.
you can do it. You'll just see the ad. It's okay. Yeah. All right, you can go ahead. Hang on. I think I can do it if you allow me.
Sorry,
Let's see
yeah, I
if
think I started playing it without sharing it. Hold on.
okay.
Together we can do it, I think. One more time. Let's see.
All right. Okay. All right. You want me to?
You can see it now?
I hang on one second.
Rajesh Kakani.
Is that the right one?
I can see you. I can see you.
Okay.
I am a board certified otolaryngologist, that is an ear, nose, and throat specialist practicing in Long Island, New York. Today we are going to talk about a particular exercise for dizziness. There are several causes of dizziness, and when the dizziness involves a sensation of spinning, we call it vertigo. And there are certain kinds of vertigo which particularly come with a change in position of the patient, and then we call it positional vertigo. You must consult a trained, qualified medical professional for diagnosis and treatment of your particular condition. But I find one particular exercise helps most patients with dizziness and vertigo. This exercise involves sitting up straight and stretching your neck in all directions with eyes open, like so. Another way to describe it is to imagine as if there is an insect or a bug behind your head and you are trying to find where that is. You are thus going to complete 5 circles clockwise and 5 circles counterclockwise, and I would recommend you do that 3 times a day. It is possible that when you do it initially, you may feel some dizziness or vertigo. That is okay. I find that after several repetitions, that dizziness and vertigo disappears and it prevents you from getting unplanned attacks of vertigo or dizziness. I would recommend that you do not push beyond your limits and do not stretch your neck to the level where you have any pain. Once again, you should consult a qualified medical professional about your particular medical problems. There are certain other specific treatments and maneuvers that are recommended for particular positional diagnosis, particular diagnosis of vertigo. If you have any questions, please visit our website www.licent.org. That stands for Long Island Center for ENT. Thank you.
Okay, I have, if you allow me, I have 3 more slides. Let's see if I can share them.
Yes, I think the hearing aid was in the wrong order, but were you going to cover that next?
Yeah, no, I'm crazy. So I don't like long Zoom meetings, okay?
Okay,
So I
totally
want to
fine.
try
We
to
like
keep
to.
it less than 40 minutes, okay? Overall, including questions. If you can stop sharing, I will try to share 3 more quick slides, okay? All right, let's see. Okay. Can I?
I think I stopped sharing,
Yeah,
right?
okay, let me
Do you
see.
still see
Okay.
something?
Yeah, let me see if I can. Okay, let's see what are my options. Okay, all right. Yeah, I think I can share it now. Okay. All right. Okay. All right. Okay. I don't know how to do this here. Presenter view. This is a presenter view. No. So hang on. Let me get out of my this thing.
You had the colorful set earlier.
Yeah, no, this is, I just, let me see if you cannot see the slide well, correct?
We can see the take home,
Yeah,
thorough
is it big
history and
enough?
physical examination.
Is it big enough? Okay.
Yes,
Can you?
we can see it. At least
Yeah.
I can read it.
Yeah. Okay. So let me read it. I'm having trouble now reading it. Okay. So the take home is in dizziness and vertigo business, a history and a good examination are the key. You don't need $1 million testing. If it is spinning, it's probably peripheral or ear related. Watch for red flags, which I'll talk in a minute. Uh, Habituation exercises help people cope with the symptoms. And if possible, try to get rid of the sedative medications. And these are the red flags. This is where, if it is necessary, you have to send the patient to the hospital. If it is a sudden onset of vertigo with headaches or neck pain, if there are any neurologic deficits like weakness or double vision or changes in the speech, if there is an imbalance not improving with time, and if there is, significant hearing loss with vertigo. And then I have a pet peeve, we ENTs, we all doctors don't agree on a lot of things, but I think, most cardiologists agree on some common things. Most ENTs agrees on some things. So these are things I think my friends Anurag and Shirish will agree that we tell everybody, please don't use Q-tips. Okay. And number two, sinusitis is primarily a medical disease, not a surgical disease. And surgery is needed to help the medical treatment. Again, there are some patients where it's a surgical disease, okay, but in general. And then the next take-home points, especially for my friends practicing in India, is we should all know the 7 symptoms of possible head and neck cancer, okay? So if any of this following lasting more than 2 weeks, the patient should see an ENT. So what are those 7 symptoms? Number one, persistent difficulty swallowing for 2 weeks, persistent change in voice for 2 weeks, persistent difficulty breathing for 2 weeks, persistent pain in only one ear for 2 weeks, unintended weight loss. So, about 5 kilos or more. Everybody fluctuates. Less than 5 kilos is okay. But unintended weight loss, more than 5 kilos or 10 pounds or 12 pounds. A lump in the neck or persistent blood in the phlegm. If any of your patient has those symptoms lasting more than 2 weeks, please, please, please make sure the patient gets seen by an ENT. All right. And then the last slide, again, whatever we talked is peanuts. It's not important. Please pay attention to the big picture. We are all very lucky. We probably are in the top 1% of the world just because of our education. Okay. And it's not about the lifespan. You got to increase the health span. And, as long as you have your friends and family, pay attention, get enough sleep, avoid all toxic substances, primarily plant-based whole food diet, avoid ultra-processed food. I think I'm speaking on behalf of Bharat, right? Okay. Avoid stress. Please, please, please exercise in moderation. And you guys probably didn't have a chance to be taught by Dr. Sipaha, Giri Sipaha. And he would come to our classroom and he would say, treatment of heart attack. And first line in the treatment was rest. And then he said, rest is a medicine. So if there is a medicine, you got to have a right dose. You cannot have an overdose. There are side effects. So with exercise also, I think it is a medicine. And I say to my patients, if I gave you a blood pressure medicine and you only took it 3 days a week, double dose, would it be better than taking? So do exercise every day, please. Do it in moderation. Don't overdo it. And you get addicted to it. Okay. And please, please, please use common sense things, wear your seatbelts, I don't like to be on the road at night, don't drink and drive, and keep friends and family. With that, I'm going to stop sharing and we're going to have chit chat. I can talk about hearing aids more if you want, but the point with the hearing aids is there are advances occurring every day. And a lot of people have hearing loss. Most people, because the hearing goes down slowly, both sides, they forget what normal hearing is. And it's the family members and friends who, oh, somebody wears it. Okay, Lokesh, nice to see you. Okay, right. So Lokesh's dad was my guru, okay, my zoology teacher, my high school principal. And when I said Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma Tasmai Shri Guru Namah, I sort of bowed to his dad as well. He was my teacher. And
Mine too.
professor at the college. Okay, so this is all I have to share. I would first
सर
request.
ये घंटी मैं इसलिए भी बजा रही हूँ कि हम जनरली शुरुआत में बजाते हैं और एंड में बजाते हैं, तो ये दोनों टाइम के लिए है, और आपका हियरिंग टेस्ट के लिए भी घंटी आप यूज करते हैं.
Okay.
तो थैंक यू सो मच सर. और मैं थोड़ा जूम और सब में डिजी हो गई, बट आई डिड रियली गेट few good points from your talk. उसमें आप मुझे पूछना था कि sedative, does it include allergy medications like Zyrtec, Claritin? Not so much Claritin,
So
but
before I
Zyrtec.
go further, I have to show my respect to my two ENT friends, Shirish and Anurag. I'll give you 2 minutes each. If you want to supplement any significant thing you want to share with primary care physicians or general public, ENT related thing that, if anybody would ask you,
Sir,
just say it.
yes, sir. I will. In our practice over here in India, especially the BPV, the most common cause I find here is vitamin D deficiency,
Okay.
because ultimately autoconia are calcium particles, and if you are deficient over here, so
Okay.
this is what we have find. The other thing is that many times you are having a simultaneous vitamin B12, because predominantly Indians are vegetarian people. Even vitamin B12 deficiency also augments such symptomatology.
Okay.
And
I
Meaniers
would
is very
say
much,
India में भी है और US में भी vitamin D deficiency is very common, especially in East and
but India
Midwest.
it's a shame to have vitamin D deficiency despite having such a sunny atmosphere practically all over the India. But that's the truth. Almost more than 80% of the population is having a severe vitamin deficiency.
All right. Any
Because
other
of our indoor
experience?
living, whatever reasons. Okay. But this is the truth, sir.
Okay. All right. Anything else you want to add? This is your chance. I want you
And
to
sir, हम
augment
तो
my
अपने
presentation,
हम
make it
अपने
better.
पेशेंट्स को बोलते हैं कि चक्करों का सही कारण ढूंढने में भी चक्कर आ जाते हैं.
Yeah, that's a internal ENT joke. We won't share it with other people.
So इस हमारे यहाँ तो हर आदमी अपना एक एक्सरे सर्वाइकल स्पाइन लेके आएगा कि जी मुझे सर्वाइकल हो गया इसलिए चक्कर आ रहे हैं. अब उनको ये कन्विंस करना है कि दिस इज नो मोर अ प्लॉजिबल कॉज फॉर एनी वर्टिगो और डिजीनेस. सबसे पहले तो उनकी ये एजुकेशन देना पड़ता है. That's the thing. That's my 2 cents. Thank you.
Rajesh
So,
sir,
is it true,
Finish
Dr. Kunal,
with
that, sorry, Dr. Anurag, is it true that cervical spondylosis is not a common cause of dizziness?
Cervical spondylosis is now no more considered a cause of any dizziness or like, because you
So
require a
what was this?
very
This
severe
exercise was
degree
not
of.
for the cervical spine that Dr. Kakani showed us. It's not for cervical spine.
It's for redistribution. मतलब जो
that
balance.
is, we call it falls in the category of what we call habituation exercise. And to explain to the lay patient in very simple terms, our brain needs blood circulation continuously. And if you have any disturbance, then what this exercise do is it trains the brain not to go crazy when the signals or blood circulation is delayed. Okay, so that is what that exercise is for. This is not a specific treatment for specific vertigo causes. I also agree, and this is where we're going to argue within specialty, and we'll do that after we get out from here. Anurag and I will fight it out.
And Dr.
But,
Kakani, I also heard that few yoga practitioners who used to initially ask their students to rotate their necks, they have stopped doing this actually.
right. So
Recently.
please, right, again, that is the key. I have a lot of neurologists who hate me because, the transverse myelitis and all that stuff can happen, okay? And, your slip disc can cause further damage. And I don't want anybody ending with a quadriplegia by trying to become the next Baba Ramdev, okay? So please, please, please don't push beyond your limits. Absolutely. Okay? Yeah. But there are other
Rajesh,
yeah, go ahead.
Rajesh sir, Shirish here.
Yeah.
So I know you may want to wind up within 40 minutes, but for synergy audience, would you add another 2 to 3 minutes on vestibular migraine? But that's a fancy diagnosis nowadays in the ENT community.
Okay.
So will be good to hear about it.
Right. So there are this again, in medicine, all branches, we all sort of develop a hammer, and then a lot of things look like a nail to us. I had one teacher in Indore who would prescribe anti-TB medication to every child that came to him. Okay. And there's probably a lot of TB there. That's what his experience is. So there are people now who would say everything in this area is a migraine. Okay. The sinusitis headache is probably a migraine. Tinnitus is probably, especially if it is episodic, is probably a variation of migraine. And Meniere's disease, especially we never understood the why it happens, is probably a manifestation of migraine. So what I where I have shifted to is that there is an endolymphatic hydrops where the fluid in the inner ear is more, and then there is migraine. Okay, so this patient gets vertigo, hearing loss, tinnitus, nausea, vomiting, fullness here. This patient only gets a headache. By the way, there is societies and there are criteria for diagnosing migraine. So this patient will not fit the criteria of migraine diagnosis. But there are a lot of patients where the attack happens after consumption of, let's say, a high dose of sodium or after having had a particular kind of wine, or I get headache when I'm sleep deprived. Okay. And I think it's a classic migraine. Whenever I'm sleep deprived, I get it. It's a problem. So I think it's a continuum between Meniere's disease on one side and the classic migraine on the other side. And some people fit in the middle. Okay. So that is where, the diagnosis of vestibular migraine fits in. Okay. To my mind. And yes, we should ask every patient of Meniere's disease as well as migraine to keep a diary as to why, what, brings on the episode. And in migraine business, I mean, the main treatment is the diary. Of course, avoid sleep deprivation, avoid, they say, everything in moderation, right? So avoid certain high doses of salt. Uh, if you can live without alcohol, avoid alcohol. Don't drink more than 3 cups of coffee and see what happens. So that's my quick answer. All right. Okay. So I'm
Lokesh
sorry,
has a
Chayaji, derailed your
Lokesh has a hand
discussion.
raised. Can he ask
Yeah,
this?
you were talking about this hearing loss and the Meniere's disease, and as if I thought you're talking about my problems only. In 2009 to 2014, 15 almost, a long time I kept on facing all these problems and ultimately landed up with hearing loss and all these things. And last 3 years now, I've been using these hearing aids. And that too was on the insistence of one of my ENT classmates. And she said, if you're not going to use this, the brain faculty of that hearing will start getting disuse atrophy. So then I started using it. But tinnitus and yes, 2009 or 10 it started. So, and since our organization chief was ENT consultant, I thought I should not wear hearing aids, otherwise you'll throw me out of the institution. But then, after all, I came out of all those social stigmata, and somehow I could started wearing it for last now 3-4 years. I'm using it. But yes, I still what you say is exactly very true. Now also early morning hours, if I find my sleep is deprived or I sleep for another 1 or 2 hours, and then I'm no more having dizziness and all those things. Symptoms still do recur, but the only remedy I found is to sleep well and then things go off. But yes, remnant problem what I have is the hearing loss. Yes.
So
And
they're all
that day I'm,
interconnected. For you, it was the
yes,
whole
they are all
session was
interconnected.
about Lokesh.
Correct. Yeah, exactly. Thank you very much. Thank you, Chaya, to bringing up this topic.
Sure.
Thank you.
Thank you, काकानी सर. एक आपने जो भरत ने बीच में पूछा था, रूम स्पिन करता है versus person is feeling like उसमें न्यूरोलॉजी और ईएनटी का डिफरेंस था क्या, कि जो
To
बैलेंस
my
ऑफ
mind, there is no major
नो
difference.
मेजर.
Rajesh and
ओके.
Anurag may have a different opinion, but to my mind, it's not that important.
और सर इसमें एक अपना दूसरा अनुराग जो स्क्रीन पे दिखा रहे हैं वो साइकियाट्रिस्ट
Oh,
है, तो थोड़ा साइकोसोमेटिक सिम्टम्स भी हो सकते हैं इसमें कुछ हद तक.
everything is psychosomatic as far as I'm concerned. Soma
But
affects the psyche and
are
the
there
psyche
times where it's
will attack
nothing
the
but
soul.
it's all in the head, like जो doctors बोल देते हैं, it's all in the head? Does that
Again,
happen?
so again, the psychiatrist can answer better, but the, you know, I mean, to say to somebody who's suffering
It's
that,
invalidating. Yeah,
yeah, that you're just thinking about it and go home and you're fine
right.
is not right. Okay, you need to listen
Totally
and you
agree.
need to uh, summarize. Okay, so that's what I would uh, say. Uh, please do seek psychiatric help. My only main take home thing about this topic is that if you are giving medicine just to see if it would help, and now the patient got dizzy, please, if you can avoid that sedative medication, please take it away. Don't leave patients on Valium and too much antihypertensives and trazodone and stuff like that. They would, even meclizine, Dramamine, they would not spin, but they would feel a little drunk. Okay, so that's the only additional thing I can add in addition to the psychiatrists who do a great job. Thank you.
That was Anurag had unmuted.
Madam,
Anurag, go ahead.
madam. So rather, I don't think it is psychosomatic. I think that these are real symptoms with it's not in the mind. But the interesting take I have on this that I've had the chance to work with a couple of people who had tinnitus, and obviously I can't help them with the tinnitus. But I think an important component is that nobody has been able to help them with the tinnitus, and I was driving them up the wall. And where I came in was to help them cope with the tinnitus when the tinnitus cannot be taken away. How do you cope with that? So I have had a very interesting therapy with both of these people. One of them is in New York, sir. So very close to you, Indian guy in New York. And then there is a American lady in Los Angeles. So I've been working with them, and we have had like very good. We have enjoyed working together, and I think that the real role came in helping them to cope with something which is not going away. Both of
Absolutely.
them have tinnitus, so that was
Thank
the
you.
interesting thing and all. And I
Thank you,
think that
Dr. Anurag.
Beautiful point,
sir,
like
Thank you.
yes, sir.
Thank you
acceptance,
very
skip.
much, Dr. Anurag, bringing this point of tinnitus. I was going to bring up this point again. Tinnitus also is one of the symptoms which I've been facing for quite many years now. Last time when I spoke to Shirish, and with that I stopped doing any more research about it. He said there is no remedy to it, forget about it. I
Or
am
go
still
to
facing, I
Anurag.
cannot forget it, but I've
Or
stopped
go to Anurag.
talking. Stop talking, talking and asking anybody also after that. But yes, when you have brought this point, I still would love to hear from Dr. Kakani if he wants to add up anything to it.
So what I say to my patients about tinnitus is that there are 4 families of treatment. Okay. The first family, of course, before we get to the treatment, you should be seen by an ENT and you should have a hearing test. And if needed, further tests, and you should rule out, other causes. Okay. But once that is done, and if it's only tinnitus, then there are 4 families of treatment. The first family is to make the outside sounds louder. Okay. So make sure you hear well and you already got the hearing aid. That is a good idea. So even though you would say, oh, how could hearing aid help me with the tinnitus? But if you hear the outside sounds well, your inside sounds you won't hear as much. And in some of the hearing aids, there are a little program which you can add with the software, and that can mask the tinnitus. Okay. There are other devices which just do masking as well, but some of the newer hearing aids can have a tinnitus masking program. And this is where having a good relationship with your hearing aid provider as well as with your ENT is helpful. The second family of treatment, I call them health supplements. So obviously get yourself tested for any deficiencies. And if you have any deficiency, please replenish that. And then there are a lot of health supplements which are sold especially in the US market. I'm sure there are enough numbers in other countries as well. And one of the main ingredients people have put in is ginkgo biloba. Okay, so health supplements may help. Something with ginkgo biloba helps. And then the third family of treatments, I call it therapy. So therapy means, keep yourself occupied, keep yourself busy. Okay. The more busy you are, the less time you will have to focus on the tinnitus. Okay. Friends, families, exercise. And sometimes, we send people for what in USA we call it cognitive behavioral therapy, which is, talking and listening and understanding. And then there are other therapies. Hold on 1 second, okay? Hold on 1 second. There are two new devices in the market. One of them is called Linear, and this other one is called Tenerity. It's made by a Danish company. That's the name of the company, Duality. Okay, you can send me a message. I'll share it with you. And what these guys do is you wear this at night, and it kind of delivers a little bit of a sound. Okay, it's a tinnitus masking. There used to be called TRT, tinnitus redesigning therapy, for which you had to go to an audiologist, trained audiologist, but this is delivered in a box and you can do it. These things are still expensive, but that's the third family. And then if all that doesn't work, then you go to the psychiatrist, and sometimes we give anti-anxiety medicines. Okay, so those are the four families of treatments for tinnitus. Okay, and there is American Tinnitus Association. Through reliable sources, you should be able to see updates. But getting the best possible hearing aid with an audiologist is the low-hanging fruit. And again, I'm going to repeat, before you get into the treatment of the tinnitus, get a good workup and make sure there are no treatable causes.
Very well. And does it overlap with hyperacusis at all?
Yes. So
Because
hyperacusis
in kids,
is a,
especially the autism spectrum and a lot of people with sensory sensitivities, they use the noise machine, the background noise machine to
right. So
help.
hyperacusis is a real thing, and then there is an extreme version of hyperacusis that's called misophonia. So our younger daughter, when she was ninth grade or something, would never have dinner with us because our chewing was so loud to her that it literally caused her pain. I mean, I'm not talking about annoyance, but pain.
Right.
So she would sit in a different room having dinner and we would have dinner. And then she grew out of it. Usually in teenage kids, I see the
Yes,
extreme.
my daughter had it too, and she has hyperacusis. So like you're saying, we had ENT look at it, and having noise machine helps. So thank you. That was
Sometimes it's
wonderful.
specific to the parents. They're very sensitive to the parental sounds and interventions, and they're fine with their friends.
Right. But yeah, I have seen patients who, the kids who will complain literally of pain from loud sounds. Yeah, so that brings me to my next topic, which is very quickly, please, 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 we all ENTs agree on one thing. Please wear noise protection. Okay. And I don't know about you, but everywhere I go these days, it just sounds louder. The Apple Watch, and in all of your phones, there is, if you can get a app called sound pressure level meter. Okay. Uh, I go and everywhere it's so loud, especially the Indian weddings, the movie theaters, any party. So I always wear some kind of earplugs. We can talk about that. That's a whole, another topic.
Oh, you
But
mean
please,
besides
please,
the
please.
cotton plug? You
So
use
you can
proper
do
earplugs?
anything that is available. Plain cotton with Vaseline will do it. Those earmuffs, those people at the airport wear, they are okay. You can buy earplugs on the store. If you buy the silicone ones are a little better than the other ones, but anything will do. Then the AirPods, and Bose actually was the first who came up with what is called noise canceling feature. So it actually cancels the noise. So I haven't traveled in a plane without a noise canceling phone. Yeah, somebody's wearing it right there. Okay. So without the noise cancelling phone in last 15, 20 years, okay? I as soon as I get on a plane, I put the noise cancelling feature on. And then you can get custom ear molds, okay? So the audiologists, they have a way to, just like dentists have a way to take impression, audiologists have a way to take an impression to make hearing aids. They can take an impression, and there are companies which will make. And I have those. And these days I don't go, I have always have them in my car. Anytime, especially Friday evening, Saturday evening parties, I take them with me. So please, 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 noise protection and whatever you can do to sort of advocate for it. If you, let's say, have a party in your own family, please talk to the DJ ahead of time. That look, we need music, but please keep the music to a lower level. See what you can do wherever you go. So yeah, noise
The
protection.
hearing, do the are hearing headphones itself cause dizziness sometimes, or
So when
right?
Walkman first came out in the 70s, some people did the research that the teenagers were listening on Walkman had slight hearing loss. And the argument they made was that these kids are listening to the loud noise at a louder level than they would have heard if they had it on a speaker sitting at a desk. So in 70s and 80s, we were saying, please don't use Walkman. But now you cannot live without an AirPod or whatever, right? So the key is keep the volume as low as you can live with. Don't don't be, and I'm sure all of us have had experience that you pull at a traffic light and there is a car next to you, and that car has so much loud noise that your car is shaking. I'm sure you've all met. Please don't be that guy. Don't be that person who has a very loud music in their car.
Very well. Thank you.
These
Thank you. I think
noise cancelling headphones are very good for marriages also.
Yes, yeah, absolutely. I don't go to any party or wedding without the noise cancelling
no,
headphone.
sir. He's talking about for marriage, like married life.
So
He's
is
saying
that that's the psychiatrist? I know.
Yes, sir, that's the psychiatrist.
Right.
because
So
we know
I'm not a
Anurag very well.
psychiatrist, but what you say makes sense. So I tried to read. So there was a retired, she died now. She didn't actually, there was a Supreme Court justice in USA, and she was, an idol for all the left-leaning people. Her name was Ruth Bader Ginsburg. So she was an attorney, her husband was an attorney, and she became a Supreme Court justice. And her husband sort of supported her career. So at the book selling, people asked her, what is the secret to your happy marriage? She said, in every happy marriage, it pays to be slightly deaf. Okay. So Anurag sir, is that true? That's your,
Very well, very, very correct, sir.
yeah.
I think they don't
Very
even
true.
have to be deaf. Most of the guys have selective listening anyway, so I don't think we need to work on that. But
Yeah,
I
and
was just
another off note,
Yeah.
madam, another off note. This talk. Well, first of all, it was so good to hear this. It was so wonderful. But this talk brought to my memory after I don't know after so many years, this marvelous movie of the same name by Alfred Hitchcock called Vertigo. And
oh
I
yes.
think that if you haven't seen it, it's for those who haven't seen it. In my opinion, it's a magnum opus. It's an extremely complicated movie, and it is quite psychologically accurate, and it has got the supernatural tones to it, and like it's a wonderful movie. It's called Vertigo. Those who haven't seen it, I thoroughly recommend it to them.
I've heard of
As
it,
an
not
off note.
watched it, so I'll add it to the list.
Oh,
And
you must, Chair, madam, you will love it. You'll love it. Just it's
okay,
marvelous.
I will definitely add it to my to-do list.
Well,
And
one question, Dr. Kakani. This vertigogenous migraine is to be dealt by ENT surgeon or a neurologist?
It needs to be dealt like everything else by a doctor who is interested in you. Okay. All right. So there are some ENTs who have a lot of degrees, and if they don't have time for you, not good. There are some neurologists, a lot of degrees, don't have time for you, not good. You need to find somebody who's interested in the subject, but more importantly, is interested in you. Okay.
sir,
And
it all comes
it
down
has
to
to be
meeting the patient where they are, right? Like it all comes down to motivational interviewing and almost validating the connection before correction. Wala jo.
What my experience was, my wife being neurologist, the ENT was pushed to neurologist and neurologist is pushed to ENT.
Right. So that is 80+%. 80+% ENTs in USA, and again, there are financial issues involving it, don't like to see a vertigo patient in their office. Okay. They just don't. They don't say, I don't do vertigo, send it to somebody else. Okay. And I think I know a lot of neurologists who are not interested in vertigo. So you need somebody who's interested. Okay. That's the summary.
Sir, before you conclude, I'm just going to.
Maya, can I
Nita,
start?
sure. Come on, please. Sir, Nita is a good friend. She's a cardiologist. Nita Datwani.
Dr. Kakani, I'm here in New Jersey, and I've been always wanted to meet you. Anurag and Shirish are my batchmates also, so just haven't made it. I also have family in Long Island, but somehow haven't connected with you. But
You should come. Call me.
yes, yeah. So, as a
have my number.
non-invasive cardiologist, you said very nicely the history is very important. I can tell when it's cardiogenic lightheadedness, and can tell when it's okay. You need an ENT. I've sent many patients over and solved their problems, and many patients I take care of myself. But just now, I just wanted to ask this noise canceling stuff that you use. What do you use?
So these days, if I have to listen to something, I just use the AirPods Pro. Okay.
Okay.
So that is if I'm in a Zoom meeting listening or whatever.
Yeah.
Usually, what I would do, and I'm going to say this to Chayaji right on her face, I don't attend the Zoom meeting. Every Zoom meeting gets on a YouTube. I have a YouTube premium subscription. I watch it at a speed, no advertisement. So that's AirPods Pro. But for the problem with the AirPods is when you go to a wedding and you are wearing them, they are sticking out of your ear and it doesn't look good.
Mm-hmm.
So I got custom ear molds. Again, unfortunately, they're in my car. I don't want to waste your time and run to the car and show that to them. But look up custom ear molds. Find an audiologist near you, about $200. They can make it for you to fit your ear. Okay. You really need something that will cut down about 30 decibels. If they cut down 30 decibels and you are in a 100 decibel environment, you're down to 70. If you're in a 90 decibel environment, you're down to 60 and you're okay. So any level of ear protection will do, from simple cotton to earmuff to noise cancelling AirPods Pro but again, most of the Bluetooth microphones now, those made by Samsung, and they also have noise cancelling features. And
on the flight, that's what you use?
I use them in my flight. I don't watch movies in the flight at all. I mean, I could. I don't. I try to sleep on the plane.
You do the sensory deprivation.
Huh?
So you're in sensory deprivation mode. You're sleeping it off.
I mean, to me, the goal of my life is to sleep well. Okay. That is if I had to summarize one sentence, life is to sleep well at
2 points.
Yeah.
2 points I would like to bring up, Dr. Kakani. One is this hearing device also has got a noise cancellation or a noise reduction, which we can do it from this Signia app. So that many times I use it in very noisy environment.
Yes. Yeah.
And,
so they have peak clipping, they have noise reduction features. Today's hearing aids are amazing and you control them with the app. And yes.
Yeah. So tell me one thing, I have got two different variants of it. One is 16 channel one and another one is 32 channel one. Some of my experience with 16 channel is much better than with 32 channel one, although 32 channel is 3 times the cost of 16 channel. So what do you recommend on this particular point?
Okay. If I have last year's MacBook program to my needs, is better than this year's MacBook that I cannot program. Okay. So bottom line is it's all about programming. So it seems to me that your audiologist has been able to program your 16 channel one or older model better than the newer model. So it's not about the model. It's
a programming related problem. Programming related problem, you mean?
Huh?
Programming related problem it is.
Right. It needs to be customized to your need. Okay. And
Program
it
too.
seems
Okay.
like the older
Maybe
model.
next time when I will travel Indore, I'll ask him to program it again properly.
Yeah, see what
Yeah,
you
maybe that. Yeah.
So that's the commonest thing I hear from general public, that they don't want to use hearing aids because of the background noise. So
Right.
you're saying it's all about programming, that they can work
Okay.
work it out besides having
So
good
there is,
device.
okay. So since we are on the topic of hearing loss, Neetaji, please send me your last name, okay, so that I can know more about you.
Yes,
And
of course.
before we switch, I also want to say thank you, Neeta, because Neeta is the one who suggested to me to ask Shirish to introduce Kakani sir, because Shirish knows him so well. So Neeta is the one who pointed me in that direction. So I am going to share the formal introduction with the YouTube, and then I'm going to just bring up the written thing here that everyone can. It's awesome writing from Shirish, and it's like about 3 paragraphs, but it summarizes all the good things that Dr. Kakani has done for his batch, not only his batchmates, but for juniors and all the MGMites, and how he's so humble, and in spite of being so good in his field and up there, he's very modest and ready to help everyone. So I think that's the gist of what he wrote. But we will definitely share Shirish's introduction with the YouTube.
And Chaya ma'am, Sudhir here, if I may add to that.
Yes, go ahead. Sudhir Mungi, the singer, Dr. Kakani, you must have heard of him, and his brother.
An
Sunil.
interventional cardiologist, and the guy you need to know if you ever end up in any part of Illinois outside Chicago. Okay.
Right, you meet at the
Go ahead, Sudhir.
MP Mana
I
things,
have a
right?
lot of admiration for each one of you. I don't want to go
Yeah,
personally,
no,
but
no, no.
I have
That's
a lot
just
of
kind of you.
admiration.
Thank you.
Yeah. Go ahead.
What I wanted to make sure I put this is Rajesh sir is like friend, philosopher, and guide for all MP grads who come to US, and he has been such a big force in our reunion. And I date back to 1994 onwards, so it's been 30 years. And that's something actually going above and beyond his professional career, because he's, of course, extremely busy practitioner and takes a lot of effort to bring a group together. And alumni have their strength, because that's the only way we can help our grads who are still coming from India. And also, I wanted to just make sure that Dr. Kakani is recognized not for just his professional excellence, but more importantly, what he continues to bring, extend the med school from Indore to US in a very positive way. So thank you again, sir, and wonderful talk. Thanks, Chai ma'am, for always doing this. Thank you.
You are next, Sudhir. Thank you. Thank you for joining. Shirish, wrap up, and then I will let sir go. Time हमने आपका ज्यादा ले लिया. आपका patient भी है discharge करने के लिए, sir.
No, I'm okay. I'm okay.
Okay, Shirish, you want to say it directly from your mouth?
In your introduction, that Rajesh sir is one of the most brilliant students that MGM has ever produced. So it's like Rajesh sir, yesterday I met the youngest world chess champion, Gukesh. So I can now say that I'm meeting another legend, Dr. I think last I met you was in San Diego. So the Rajesh sir is the one who scored century in every match that he played. So that's how the gold medals were. And I remember you treating us when we came to EMS as part of NGM team to participate in the Pulse. And you really found time for us to treat us with dinner. And the other memory I have is you came, during your vacation, I remember Mundra sir inviting you to the MYH ENT department, and you were talking to us about medialization thyroplasty. Those things were so alien to us, but now I look back and I can remember you made it so easy for us. Thank you very much.
Thank you. No, that's wonderful. All right. Did I leave a last question unanswered? Was there a question? No, I don't remember now.
I think Zyrtec was one thing I had asked you, if Zyrtec is considered sedative.
Yeah, so again, I give long answers to short questions. So the best antihistamine to my mind is Benadryl. And their copycats came around, and the only way they would sell them is they would say, oh, our product works almost as good as Benadryl, but doesn't cause sedation. But they all cause a little bit of sedation. and there's a gradation. So if Benadryl was here in sedation, maybe Zyrtec is here, maybe Claritin is there. But yes, there is a slight component of sedation. I mean,
And
with
then
every.
for in pediatrics, there's been a lot of concern about behavioral activation and some behavioral issues with people who are on these medications long term for chronic rhinitis and stuff.
I mean,
So,
overall, I have become, every medicine that you're taking long term, please negotiate with your doctor every 6 months. Do I really need to continue it? That's all
okay.
I.
And my personal last question was about itching in the ear.
Oh,
I
good,
know
good, good, good,
you did
good.
say that we don't use Q-tip or anything, but the itching I hear more and more as you get older. Is it just the dryness, or is it something relation to reflux, or there's some things I've heard? What do you recommend for itchy ears?
So the first answer is I don't know. Okay.
Okay.
All right. And then there
Honest.
are people who would call it dermatitis or eczema of the ear canal. You can call it whatever. But I'm going to take the ear model. Okay. The key is, first of all, they call it wax. It's not wax. It's shedded skin with some oils.
Right.
Number two, this is, as we talked in the beginning, is the outer canal. Okay. The wax is only made in the outer part of the outer canal, the part that I'm covering. It's never made in the inner part of the inner canal. There are no hair in the deeper part of the inner canal, ear canal. Okay. So to my mind, that guy, he made a cleaning system only in the outer part of the ear canal. And you do something to scratch it and you push that epithelium deep in there. And then now that's going to irritate you and you're going to feel itchy. Okay. So the first thing to do before you treat for long term is please, please, please don't put any mechanical device in your ears, including earbuds, for 2 months, and you will already be better. Okay. So how do you survive those 2 months? Okay. So one time you can get yourself cleaned out, okay, by a good ENT, obviously. And number two, then what I give is a little bit of an oil spiked with a little steroid. So in USA, they sell it as fluocinolide. It's spiked with, it's like mineral oil spiked with some steroid. But any steroid will probably do. The brand name in USA is called Dermotic. Okay. But again, everything in excess is bad. So the ear drops that have some steroids, if you keep putting them, then they dry and they leave the powder there. So don't use the ear drops more than what you need. Use the minimum. So only as needed. For itching, I prescribe ear drops with steroid.
Great. No home remedy like the vinegar or something I've heard.
You're getting me on my joke front, but my joke is, in Kerala, the mom puts in coconut oil. In Gujarat, the mom puts in peanut oil. In Punjab, the mom puts in mustard oil. In Italy, the mom puts in olive oil. In America, we put baby oil. Okay, any oil will do.
Oh.
But
And some
but
people put breast milk in there too, if you have heard of that,
and there are
in
other
the
things.
eyes and ears.
The key again, if you're going to put drops, especially in a colder climate like north part of USA, make sure the drops are warmed up to about 98 degrees Fahrenheit, ideally. Okay. Otherwise, patient may get dizzy from the drops.
Okay, good point. Warm. Thank you. Thank you. I think we will let
सर इसमें
you
मैं यहाँ पर अपने
conclude.
पेशेंट्स को एक चीज बोलता हूँ
हाँ.
ये जो आपने बताया ना कि डिफरेंट स्टेट्स में डिफरेंट ऑयल यूज करते हैं तो मैं उन्हें यही चीज बोलता हूँ कि अपने कान को ना समझो कढ़ाई इसमें तेल मत डालो मेरे भाई.
Yeah. Yeah. Again, I completely agree. So let me just repeat the second thing I wanted to say again. One was the Guru Brahma, Guru Vishnu. But second thing, I do salute each one of you because you work in a different environment. I mean, I could never practice in India. And I don't know about Chayaji and Sudhir and Neetaji, but I can say it loudly. When I have an Indian patient in my office in New York, they don't come and tell me a symptom. They first tell me their analysis and a diagnosis. Sir, I'm here because I have allergic rhinitis and I have a deviated septum, so my nose is always congested. Now, why are you here? Okay. So again, that was an oversimplified version. But so my the point I bring that up is I salute each one of you because you work in a difficult environment, and I Anurag, especially. Okay, so I salute you. Thank you.
Non-stop phone calls. I know Anurag gets non-stop phone calls round the clock. So salute
नहीं
to.
नहीं ऐसा नहीं है मुझे बस 2 शेयर अर्ज करने में ड्राइव कर रहा हूँ मुझे बस 2 शेयर अर्ज करने वटाइगो के ऊपर कि गिरते गिरते एक दिन आखिर संभलना आ गया गिरते गिरते आखिर एक दिन संभलना आ गया जिंदगी को वक्त की रस्सी पर चलना आ गया
वाह, बहुत बढ़िया।
Beautiful. Beautiful.
और एक और ऐसा थोड़ा सा फंसी वाला कि होशो हवास में बहको तो कोई बात बने होशो हवास में बहको तो कोई बात बने यूं नशे में लुढ़कना तो यार पुराना हुआ
क्या बात है। होशो हवास में लुढ़को, बढ़िया, बहुत बढ़िया।
So sir, I'm just driving on the Delhi road, so I will just bid adieu to all of you. Thank you, sir. Thanks a lot. बहुत ही
Thank
बढ़िया
you. I
लगा
hope
to
you're
connect
going
with you.
for a wedding with the noise cancellation headphones, Anurag. And thank you, Kakani sir. आपने बहुत अच्छे messages दिए. I loved the informal part as always. And
Best,
and
best
hi
tinnitus
Ayush. Ayush is junior in Anurag.
He's also an ENT now.
is just one, the best
He is
tinnitus
an
master.
AI, sir. He is an AI, much
He's an
better than
AI. Wow,
ENT.
that's what we need.
Much
So,
better than
nice to
ENT.
meet you.
Yes, Shirish, go ahead, and then I will do Ghanti one more time, and we'll stop the recording.
I'm saying that the best tinnitus masker is the partner snoring.
Oh, on that note, I think there is a device I'm going to invent which reflects the snoring back to the person who it's coming from. So it goes and wakes them up. So that I'll put a copyright on that. Thank you, Kakani sir. बहुत अच्छा लगा आपके साथ
Madam,
hanging out.
nobody wakes up to the sound of their own snoring.
तो वो डिवाइस बनाऊंगी ना, मैं उससे एम्पलीफाई होके जाके उनको शेक करेगा वो। बट काकानी सर, आपका मैंने बहुत सालों से नाम बहुत सुना था बिकॉज यू वर आशु दादा's बैचमेट इन ऑल द गुड वेज, but today it was wonderful to spend some time with you. So I'll stop the recording here and